is Rebecca, and I'm a mental health counselor. I've been receiving questions about what are the different types of mental health professionals. Sometimes people ask me, so Rebecca, do you write prescriptions? Are you able to offer a diagnosis? Are you able to tell me if I have clinical depression? Are you able to do those kinds of things? So hopefully in this video, I'll be able to help clarify some of the differences between mental health professionals to the best of my ability. And I'm going to start with psychiatry. A psychiatrist is actually a medical doctor. This is an individual who has gone to med school and graduated with a medical degree. And they have taken a residency in psychiatry, and so they're qualified to offer a diagnosis. They can tell you if you have, based on the tests that they do, they can tell you that, hey, you have clinical depression, or you have schizophrenia, or you have bipolar. They are qualified to give you a diagnosis. They're also qualified to write you a prescription to manage those conditions. So they can write you a prescription for clinical depression or for anxiety. They're very qualified to do that. In most cases, they do not offer talk therapy. In some cases, they may, but they mostly focus on those areas that I've mentioned: diagnosis and medical management through medication. And secondly, we have psychologists. So psychologists are actually, they're not medical doctors. Their degree is in psychology. Some have masters in psychology, and some have PhD in psychology or a doctor of psychology. They are very well qualified in also performing assessment and tests. They can do psychological testing. This is where they can tell you your IQ, if you have a learning disability, if you have ADHD, if you have a personality disorder. They're able to do those kinds of assessments and give you a diagnosis as well. In many cases, they do not prescribe medication, okay? But some of them may also offer talk therapy and counseling. Then we have marriage and family therapists. These individuals have taken degrees with that title, and their training enables them to work with individuals, couples, families. They too do not offer a diagnosis or do not prescribe medication, but offer psychotherapy, counseling, and support to individuals. There's also a big, broader group of counselors and therapists that have various degrees at a master's level, such as Master of Science and Counseling, or Master of Education with a specialization in counseling, or a Master of Arts with a specialization in counseling. So these individuals can also offer psychotherapy. They do not offer diagnosis or medication, but they are skilled and trained in their degrees to offer psychotherapy and counseling. The term counseling may be used by different individuals who may or may not have a degree or a master's level education. And that's why you'll hear people referring to themselves as a spiritual counselor, substance abuse counselor, school counselor, life coach, rehab counselor, grief counselor. So these are actually titles that describe the work that they do. They're not necessarily a university degree. They are titles describing what these individuals do. And so these individuals may or may not have a degree, but that's a description of what they do in their work. Next, we have social workers such as myself. Social workers are a very generalized group of individuals because, especially at the bachelor level, they wear many hats. They can be case management workers in child and family services. They can be, they can work in a hospital to discharge planning and offer supports to families and individuals. So they work in different service areas. However, master level social workers are more specialized, they specialize more in a certain area of practice. And for example, myself, my specialty is in counseling, and I've also taken extra training beyond the degree that enable me to offer psychotherapy that's more specific. And in my area, it's attachment and trauma because I've taken additional trainings for that. So I am a social worker, I am a therapist, and I have taken extra education on top of my degree as well. When it comes to registration, I am a registered social worker. That means that I do not just practice independently. I am governed by a body, a licensing body, and I have gone through that process of being regulated to offer services that protect my clients from any type of harm. So it's important when you're looking for a practitioner to also ask them, are you licensed by a body? Do you have liability insurance? Like things like that. It's just important to be able to receive services from an individual who is under a licensing body, who is registered and is following certain protocols from their licensing body. So for myself, I'm a registered social worker. Some individuals with other master's level degrees may be licensed under certified counseling titles or licensed professional bodies. And so that's an important factor as well. Then we have psychiatric nurses. These are nurses. They've gone to nursing school with a specialty in mental health intervention and counseling. The nurses, same as social workers, they do not offer prescription unless they are nurse practitioners. Because nurse practitioners, their work is similar to a doctor. So nurse practitioners can prescribe medication, but a psychiatric nurse can assess and treat through talk therapy as well, and other interventions such as problem solving and stress management type of intervention. And so those are the different types of practitioners who are out there. And so within all these professions, there are opportunities where each of these individuals can further their education and certification in other branches within mental health. And so within their specializations, for example, I have further gone and studied EMDR, which is trauma-based therapy. And so a psychologist can go further and specialize in EMDR as well, or a nurse can do the same. So that does not change our education. So we come into the field with a degree in our area of university education, but then within that, we specialize in areas that we're interested in, or in a population that we're interested in working with. So as a clinical social worker, I may specialize in working in addictions, for example, but I have chosen to specialize in attachment and trauma. Attachment and trauma is not my educational background. Social work is. The most important things to look for when you're looking for a mental health professional is asking yourself the question, am I wanting a diagnosis? And if the answer is yes, then you want to be looking for psychiatric services. The next question that you might want to ask yourself is, am I wanting a prescription? And in that case, you want either your medical doctor or a psychiatrist as well, because they prescribe medication. And then the third question is, am I wanting psychological testing? Am I wanting to know if I have a personality disorder, a behavioral disorder, a learning disability? And in that case, you want to visit your psychologist. And if you're just looking for talk therapy or problem solving or stress management or self-esteem counseling, then you want to look for the other types of professional mental health counselors who have backgrounds in counseling, marriage and family therapy, social work, or even psychiatric nurses for talk therapy and intervention and support. Those are the broad categories of helpers. I hope that this was helpful in helping you identify the different types of professionals that are out there based on their education qualifications. We also have categories of individuals who offer counseling, but they don't have master level education. They may have a diploma in community counseling or a diploma, a 2-year college diploma in counseling and counseling skills. And those are helpful as well because they're trained in active listening and helping you with day-to-day struggles. But they're not really therapists, but they are also helpful mental health workers that can be helpful to you on a community level. I hope that clarifies the different levels of mental health practitioners. Hopefully that can help when you're looking for somebody to work with, depending on your personal needs. Thank you, and we'll see you next time. Bye-bye.